The afferent arteriole goes in to form the glomerulus and leaves as the efferent arteriole because the afferent arteriole is thicker in diameter than the efferent. It builds up a lot of pressure. We call hydrostatic pressure. You guys might call it blood pressure. That allows a driving pressure to pass the blood into the filtrate. The efferent arteriole becomes the peritubular capillaries that wrap around the tubule. The first place is called the proximal convoluted tubule. Proximal because it's close to the Bowman's capsule, convoluted because it's convoluted, and tubule because it's a tubule. First is glucose being absorbed through facilitated diffusion. Then we have amino acids absorbed through facilitated diffusion. 70% of ions are absorbed through active transport, which creates a hypertonic environment inside the tubule, creating an osmotic gradient where water is reabsorbed. Then the filtrate goes into the loop of Henle, and the loop of Henle works a little bit backwards. The ascending limb reabsorbs sodium through active transport, and the descending limb allows the water to move into the interstitial tissue along its osmotic gradient. As a rule, the more arid the environment you live in, the longer the loop of Henle you have. Right, then we get on to the distal convoluted tubule. Distal because it's far away from the glomerulus. Convoluted because it's convoluted, and tubule because it's part of the tubule. In here we've got secretion. Inside the distal convoluted tubule, ammonium ions and hydrogen carbonate ions are put into the tubule to balance the pH of the blood. Anything that's left inside the tubule now becomes the urine. If you are dehydrated, the hypothalamus tells the posterior pituitary to release ADH, and ADH inserts aquaporins into both the distal convoluted tubule and the collecting duct and allows more water to be reabsorbed. That leads to a lower amount of water in the urine, which means your volume is down, we call that scant, and it has a higher concentration of urea.